So, Doc, it's quite interesting listening to the patient there and him informing us that he went to a local clinic
Right,
and that the doctor was not really present at all.
right.
He met the doctor briefly at the start. So, are you finding that this is quite a common thing that you're encountering here in Newport Beach and
I
seeing a lot of,
have.
yeah.
Yeah, unfortunately, I've seen, in the last couple of years, I've really seen this grow. There's probably been about 30 to 40 new hair transplant practices in the area. And essentially, it's primarily been, it's being done by technicians and assistants. They're setting up shop in a corner of a doctor's office. Doctors, saying hello to the patient on the morning of surgery and, might be involved for 10 or 15 minutes and then essentially leaving the entire day and an entire surgery to the technicians. And unfortunately, a lot of times these technicians they don't even work for the doctor. They're just getting them, on the day before surgery.
Yeah.
There's an app where you can actually
Yeah.
request hair transplant technicians.
Which
I
is
mean,
frightening.
it's
all things
it's a
considered.
genius idea, but I mean, it is frightening because
It's not in the best interest of the patient.
it is not. It is not, and
Which
so
is what you are all about here at Medina Hair.
right. So in my practice, I'm involved in every aspect of the surgery. I'm hands deep in the surgery, doing the procedure. Of course, I have assistants and technicians. You cannot do hair transplant surgery without assistance because, you're taking 2,000 grafts of live tissue. You need help doing that. This is not a one-man job. It's a team, but the team needs to be led by the surgeon. The surgeon needs to know what they're doing in regards to hair transplant procedures. They need to have the experience to do it, the confidence to do it. They need to have the tools to do it. A lot of times, doctors have only one tool to do a surgery, one machine to do a surgery. That doesn't work for every patient. You need to have multiple instruments, multiple tools, know how to use them, and you need to have good staff that supports you in order to have a successful surgery. And, we can see, unfortunately, our patient today, he didn't have a great outcome. He spent a lot of money. He's, unhappy with the results. And, this is something that I've just seen so much recently. When patients see me in consultations, I actually give them a consumer alert. I give them a page that describes this, gives them some organizations like the IAHRS that they can go to, or forums like the Bald Truth and the radio show where they can actually find more information about this, be more informed about what they're having done, how the surgery should be, and how the doctor should be doing this.
Yeah, and it's not a case of you being biased, you must come to me. You're actually referring your prospective patients to third-party
Absolutely.
trusted sources.
Absolutely.
So that patient can do their due diligence on their own and do their own research to get educated and informed. So then essentially then they will want to come back to you.
Right.
Because you've actually informed them where to go to get this independent advice.
Absolutely. I mean, everybody has Google. If you're doing a hair transplant, everybody has Google. You can Google all the stuff and just get the right information, be educated, and things need to make sense. I mean, it's got to be common sense to you that, what's being told to you and what's being sold to you. It's got to make sense to you.
But patients, unfortunately, like we know, are being they want to be told what they want to hear, what they need to hear.
Right.
And sadly, Google, this patient that we've seen today, he's disclosed, went to the top of Google, saw the advert, went to that clinic, and at the end of the day, he's had his hair transplant performed by an untrained technician.
Right. And the sad part of that is I call it the faking it till you make it. It's just how much money you spend on Google. Yeah. If you spend, $100,000 a month, you're going to be at X level on Google. The next guy spends more than you, they'll be on top of you, and they'll spend any amount of money to portray themselves as being the best, hair surgeon, and most of them have done few hair transplants in their life.
So what would your advice be to any prospective patient that is now watching this video? What would you say the best thing they can do before they even opt for a consultation?
Well, the best thing they can do is research into 2 to 3 doctors and find a couple organizations like IAHRS that accredits, well-trained, well-known, well-documented hair transplant surgeons. Look on their websites, make sure that there's lots of photos, lots of videos, lots of original content for the doctor showing that, this is what they do. Make sure that the practice that you're going to go to, they specialize in hair transplant and that's all they do. Like me, I'm not doing, nose jobs one day and hair another, or, mole removal one day and hair another. I just do hair. That's what you want to go to. And, there's a group of physicians and surgeons like myself that this is all we do. Those are the guys you want to go to. And then once you go, you want the questions as, who's going to do the surgery, how many surgeries you do per day, am I going to have assistants or technicians, doing surgery on me or not? Of course, the answer should be no. And just get a feel for the practice and for the doctor. Don't go to places that are, really trying to push sales on you, and you leave for a consultation and they call you 10 times every single day, discounting things, trying to just get you in to make a buck off you. Those are the practices where I think you're going to end up, having problems with, and then you're going to end up showing up in a practice like mine for your repair work, similar to our patient today.
And I think to just add to that, which I think is excellent, is to use common sense when doing this. Try to take the vulnerability and the desperation out of jumping into having a hair transplant.
Sure.
Press pause, and I think to add on to everything that you said, I think it's a minimum process of 6 to 12 months research prior to having a hair transplant, so that you do not become a repair patient as this patient we're seeing today.
Absolutely. And, and other great resources yourself, go to specshair.com, talk to Specs. I've had patients email him, call him, and you've been really, really great with reaching out to people, giving them a third-party perspective and a third-party view as to, yes, I've seen the work of this doctor and that doctor and this doctor, and I know that, their work is good. Look, at the end of the day, we just want patients not to be harmed. I mean, how much repair work I'm doing, I'm doing so much less regular hair transplants today and so much more repair work. And it's sad for the patients. And, I think as humans, just being ethical, we should try to change this and try to put that information into the patient's mind and get them thinking. And again, these organizations like IAHRS, The Bald Truth, Specs, guys like you, this is great for the industry, because without you guys, this thing's a runaway train, and eventually that train's going to crash.
Boom.